Hello, welcome to Heartland Cares, HIV 101. Today I'd like to invite you into a really important conversation I'm having with some different employees at Heartland Cares who do a lot of important things, and also some things that you can do to help us out, and some important things you can do to help yourself. So if you'd like to join us in our conversation, I've got Issac here today. And Issac, tell us just a little bit about yourself and how you started at Heartland Cares.
I came to know Heartland Cares when I was in the hospital, and I found out through my doctor that I was HIV positive. And I've been at Heartland Cares for about 2 years now, learning more about HIV virus and doing outreach. I volunteer in outreach. I've worked my way up to being part-time staff. Outreach I love, and the people that I work around is I got so much support by doing that, and I'm just trying to help others not to get to where I was, you know, when I first found out, and to start taking medication and taking better care of themselves.
Well, and so your life is definitely not over, that's for sure, with that diagnosis.
It's just begun, really. Yeah.
That's wonderful, and we really enjoy having you and appreciate all you do.
Thank you.
And then Terry Stalions.
Hello.
You've been at Heartland Cares for, my gosh, how long now?
It'll be 9 years next week.
9 years. 9 years next week.
Next
We've
week.
got an anniversary.
Mm-hmm.
Okay, and what have you done at Heartland Cares?
I started there. I started there in prevention about 9 years ago, and I worked with the men who have sex with men community, and then they called me the job hopper around there. I think I've had every job there over the 9 years. I've worked in the care coordination program. I've done some public relations work, and now I'm back in prevention, and I do prevention education with people who are HIV positive, and I'm the Director of Social Services.
Wow, big title. A lot of hard work. And then we have Molly Stevens. Tell us a little bit about your job, Molly.
I started at Heartland Cares about 3 years ago as a volunteer assistant in the volunteer program, and I moved on to substance and alcohol program that we had for a couple of years, and now I am supervisor of community development.
Excellent, excellent. And Shane Burkeen, last but definitely not least.
Well, my name is Shane Burkeen, and I actually work in the prevention department. I started out at Heartland Cares, kind of switching over from a very similar job, drawing blood at hospitals and learning about HIV and really trying to advocate patient care, and it was just an easy switch for me. And I've been working in the program now for 6 years, and some of y'all may have seen me on Channel 6. We do a little kind of question and answer session every third Tuesday of the month, so I've been getting a lot of people that are getting familiar with my face now.
You've become our media person. So Heartland Cares, you know, as executive director, I've been there for over 10 years now, and I've seen it grow from one little building downtown to, I think my office was literally in a closet, to now we are on North 30th at 619 North 30th Street between Clay and Trimble, in 32nd and 30th. So we're a huge organization with all of these different programs that we're talking about today. But, you know, why have we grown so much? My goodness, you know, people always ask me, you know, where is this? Where do you work? And we have that here, and we have HIV here. You know, why have we grown so much? My goodness.
And I think you just answered it there. You just answered it there. HIV is here in Western Kentucky. So, I mean, that's why we're growing. The numbers statistically over the nation are growing. You know, the HIV infections aren't going away, they're increasing.
Yeah, yeah.
Well, and not just that, but people are living longer with HIV too. So people aren't going away. So in addition to the people who we've been taking care of since we opened, we still get new people. So we grow in numbers because people don't go away.
Right, and importantly, not only do they don't go away, but they become healthy and productive and are able to have jobs and make a difference to our community.
And that's why I love outreach so much, that we can get out there and reach people and let them know, although you contract HIV, test positive for it, that don't mean your life is over. You know, it's not the stigma that we see had been seen in the past on television. You know, because I'm living a better life today than I ever have. Because you know, mine also. What helped led me to that was I'm a addict, a recovering addict. That say going on 5 years. You know, and through that behavior, I didn't take precautions to protect myself. And now I'm all about protecting yourself, no matter what age group. And I found that Heartland Cares, my co-workers care so much, not only with their family, with other families, you know, the person themselves. And I think that there's more people once they find out that, hey, you know, I can live longer. It's not a sign of death, you know, because I have it. More is coming out, more is getting tested, and we need that. You know, we need more people to come out and say, hey, I want to know my status. You know, whether you think you are or not, just come out and get the test. Put another smile on your face. You know, every day is not going to be a perfect day, even, you know, if we don't have it. But at least we know our status. You know, we can get medications. They got medications today that works wonders.
It's funny you said that, because that's still the thing that people say when they come in to get a test is, I don't really want to know.
Yeah.
I'm scared to know, when the best thing you can do today is know your HIV status.
Yeah.
You know, it's a good thing to find out. If you've got it, you want to know that you have it, because there's good medication,
Absolutely.
there's good health care. You're going to go on and live a long, healthy, productive life and be a member of society and go on with what you were doing. But you want to know what your status is. So it's a really good reason to get tested, even though it's the main thing that scares people away sometimes.
I think that's great to talk about, because I've been here, like I said, for over 10 years, and the first HIV test that I did was, I think it was for National Testing Day in June, and I went down to the Civic Center, and I was, you know, I just wanted to know, I was going to take this job working in HIV, and I wanted to know what it was like to go through a test, you know, and I thought that would help me in helping people if I know what it's like. Well, I sat down and started hearing all these questions they were asking me, and I had been in a bad automobile accident and had lost a lot of blood, and I started thinking about that. I started, you know, thinking about, well, you know, I've been married and divorced and remarried, and you know, trying to think about, what do I know about the person I was married to before, because they just kept asking me these questions, and I thought, here I was going to take a test thinking, you know, I'm just doing it to know what it's like. And by the time I walked out of there, I just was scared to death that I had HIV. And I had to wait 2 weeks because it was a blood draw, and that was the longest 2 weeks of my life. I just, you know, we don't understand the things that put us at risk, and you know, to even know whether we should take a test or not. And since that time, the tests have changed. Go ahead, Shane.
Well, and even, Krista, not to say anything bad about your parents, but do you know their HIV status?
Oh my gosh, no. I don't. They probably smacked me if I asked them. I don't know.
Well, yeah,
but
a lot
really,
of people really don't think of that, and you know
that's not my business.
Well, it is your business because it is your health.
So as far as like perinatal transmission,
sure.
you know, like if my mother were positive, you know, when I was born, then she could have transferred that to me.
Yeah, it just seems like everyone says, well, I don't need a test, it doesn't affect me. Well, it does affect you. You may not even realize it, so it's just a good thing to get a test.
Well, the Center for Disease Control back in, I think, 2006 recommended that everybody make an HIV test part of their annual physical, just because of the world we live in today, and just make it part of your health. And another reason they did that was to kind of take the pressure off of doctors and physicians to ask you if you wanted to get a test.
Right.
Because a lot of, especially in a rural area like this, a lot of people still attach a little bit of stigma to HIV, and even doctors are afraid to say, you know, do you need an HIV test? They think they're insulting you. So the CDC kind of made this recommendation to say, you know, it's just something you do. You just get an HIV test. They used to, you know, there are target populations, people who are more at risk than other people. But, you know, HIV's been around more than 25 years. Everybody is at risk for HIV now.
And
you can't just say it's a certain group of people.
And you said something about stigma. A lot of people find out, well, say if I have HIV, they want to back away from me and get away from me because they're scared to sit in the same seat, scared to eat out of the same utensils. Well, that's not the case. The case is the public, the other people can do me more harm than I could ever do them.
Right.
It's vice versa. You know, because someone with the flu or something like that, and I get it, and my immune system's already weakened, and it takes maybe a month or two for me to get over the flu, when it might take somebody that doesn't have HIV a week, or you know, something like that to get over it. And it's more of the public harming me than me harming them, because you can't get HIV by sitting in the same seat, drinking from the same cup, using the same utensils, or kissing. You know, it's just not passed on by that.
Sure.
Right.
And I'm going to go back to what Terry said, because I think that that's really important. How many of us have ever gone to our doctor and said, you know, I want to have an HIV test, I want to be tested for STDs, and I want to know more about hepatitis A and B vaccine. I know, you know, that children are being tested for hepatitis B, or being vaccinated against hepatitis B, so what about me? Do I need that too? And what's that about, you know?
You know, it's funny that you say that, because I actually asked my doctor whenever I first moved back from Lexington, because I didn't know any of the places to get tested around here for HIV, and I ended up having to go to a blood drive to give blood, because I knew they do an automatic HIV test, because my doctor said, well, you know, we do HIV tests, but it's really, really expensive, and I really don't recommend getting it. And I was like, well, do you know anywhere that gives HIV tests? And he's like, no.
Wow.
So I mean, it's amazing that.
Now, was this before Heartland Cares was here?
Yes, it was before.
Okay.
Well, before I started working at Heartland Cares, yeah. And that's how I found out about how to get tested. Was I happened to be chatting online with some people, and they told me, hey, there's this great place, Heartland Cares, and they come to the lake, and you can actually get an HIV test there. And I was like, the lake? you know, I've drawn blood all my life. I mean, I'm like, don't you have to do that in a lab? Don't you have to have needles? How can you do that at the lake?
Right.
And you think that going to the doctor or being in the hospital, when they take blood, they test for HIV and other STDs. They don't, unless you ask for them specifically. And I would, you know, my daughter, I recommend her whenever she goes for a regular physical, ask for one. You know, it doesn't.
Well, you know, we're concerned about our cholesterol, because, you know, high cholesterol, they say, can kill you. You know, so we want to make sure we get, you know, our cholesterol results, so we know about our diet and what to do, because there's things we can do if we find out we have high cholesterol. And we should be just as concerned about, you know, other things that can cause us harm, and because there's things that we can do if we have those too. There's precautions we can take, there's medicines we can take, whether we've got an STD or whether we're trying to prevent getting something like hepatitis A or B. And, you know, we just need to be educated, and we need to know. But I think more importantly, we need to be in control of our own bodies. You know, like, I don't know, Molly, when you go to the doctor, do you tell the doctor everything about yourself and what you want and make demands, or does he just tell you what he's going to do?
Well, I think it probably depends on my mood. If you want to know the truth. You know, I think that a lot of times I just listen to what they say and go on, you know, because you're rushed, or you know, you've taken the time out of your work day to maybe go visit the doctor, so you don't really take the time to tell them your personal concerns. But over the last, you know, couple of years, I've made it a point to take a list in with me to say, you know, because I forget. My coworkers, you know, I'll forget, you know, something that maybe I need to talk to them about. So, you know, I find that helps a lot of people. And we talk to our volunteers and our peers about making a list when they go in and talk to their doctor of other concerns that they may have, because it is helpful. So I think, you know, it kind of goes both ways. I think it depends on the time, but I think the best way to do that is, you know, just, you know, as you're going through the month and you know you got a doctor's appointment, just kind of write down things that, you know, that you're not feeling well, you know, if you're having headaches or if you're feeling light, you know, headed, and just things that you may not think to tell them if you're rushed and you're feeling good that day and you're in there. So
and being on, and me with having depression and anxiety, you know, it's best for my doctors to know, like you said, having like a calendar sort through the month. Well, this day I felt this way, and this way, you know, day I felt this way. It gives them an idea of the time that it happens, and it sort of lets them know if it's the medication I'm on, because medication has all kinds of side effects also. And it more informs my doctor on what to look for or what to do. And me and my doctor have a wonderful relationship. And he's also at Heartland Cares. We have an total in-house medical staff, you know, and that's great, because I work right along with my doctors and my care coordinators, the whole 9 yards. That's become my family now. The reason I say that, I've dedicated the rest of my life to helping other people, and what better way to do it than through Heartland Care. You know, the Heartland and the cares on the end of that, that's really what the whole building is about, caring for others first ourselves.
Thank you, Isaac, very much for that. Yeah, I think sometimes, though, when we go to the doctor, we're embarrassed. We're sexual creatures. You know, it's necessary for our survival. And it's normal to have sex. I mean, there's things that we can do that can cause us harm in having sex, and we're going to talk about some of those things, but I think that it's like this, there's a stigma with that too.
Well, you said that word normal. Even, you know, is it normal to have sex? And then if you have sex, what's normal sex? And so you have to tie all that together, because then you're going to go to your doctor here in rural Western Kentucky and, you know, tell them what you're doing, and you have to decide how you're going to do that. Plus, it's rural Western Kentucky. Your doctor may be your uncle, or it may be your best friend's uncle.
True.
And so you're like, how am I gonna tell him all this and get the best health care? You know, at the clinic, you hear people talking about, you know, I've got to go tell my doctor this. And they're like, you know, and it's the HIV clinic. They're just like, I'm not telling my doctor that.
Sure.
You know, so it's just something you have to weigh, when really it shouldn't be. It should be about your health. You know, this is what I need to know. Here's what's going on. So here's what you need to know.
I want this to be a part of my normal
Right.
medical routine. You know, you draw my blood, and these are the things like, you know, someone my age, I want, you know, I'm going to ask, you know, I want to know what my hormone levels are.
Sure.
And that's really important to me, because that's, you know, if I know that, then it's something I have control of. And then I can, like I said, do something about that. So it's all about being in control of your body, and saying, these are some things that I want to know the answers to, that I'm interested in, and I want this to be part of my health. You know, if I'm sexually active, then I want to make sure that I'm educated and that I'm getting the tests that I need. And one of those tests that I want is HIV. And if I have some concerns about STDs, I might want some tests for that too. And do you have a problem with that?
Well, and I think that the goal, as far as, you know, whether you're HIV positive or HIV negative or diabetic or high cholesterol, when you go to your doctor, is to be healthy, to be overall just be healthy. So it's unfortunate that you know, a lot of people in this area and other surrounding areas have that stigma, you know, that they're afraid to talk to their doctor, because the whole goal of that appointment is, let me get healthy so I can stay healthy, and my kids can be healthy, and, you know, my partner can be healthy, and, you know, so that, to me, I find that a little unfortunate that we have to be afraid to talk to our physician or, you know, our nurse practitioner or whatever about things that we need to know.
And it's a two-way street, really. I mean, we can sit here and say, you know, I'm embarrassed to tell my doctor that because it's rural Western Kentucky, but that's not going to change if you don't step up and say, well, I'm going to have to be the first one to say this and help my doctor to be okay with it, or it's never going to happen. It's never going to change.
Well, and I think it's normal, piggybacking off of you know, with the normal sex, you know, everybody's definition of normal sex is different. I mean, is it Bill Clinton that, you know, oh, I had oral sex, I didn't have sex, you know?
That wasn't sex.
Yeah.
That's
so
hard. How long are we going to use that?
It just seems like everyone has a different definition, and if they don't think that it's a sexual behavior that they put themselves at risk, they're not going to ask about it. They're not even going to know.
Right.
I think that's really important. And if people aren't comfortable with having a test or talking to their doctor about a test, they can always come to Heartland Cares for a test.
That's just what I was going to say about Shane. That's kind of what makes our job so interesting, I guess, because when you come and get a test, then you know, we're like, hey, you know, tell us what's going on. And
no
we're
judgment.
Just no judgment at all. We're just here to help. You know, that's why we all do this, is because we want people to have access to that. You know, come in and say, here's what I'm doing. How do I need to worry about HIV from that? And we're just going to tell you. You know, we're going to here's what your risk is, and it just involves blood, semen, vaginal fluids, and breast milk. You know, what are you doing that's going to bring you into contact with those fluids, and in what amounts, and in what contact with the other body parts, mucous membranes, blood. You know, we're just going to cover it, but it's not a judgment thing. When people come in and get a test, at the end of it, they're like, wow, you didn't tell me I should stop that.
Well, and some people halfway through just a normal conversation of them getting some of the stuff off their chest, they're like, whew,
yeah.
you know, this was easy. Yeah, I'll take one now, you know, just to be sure or no, but I'm okay, you know, because, you know, we have, you know, some of our youth come in, you know, that have been told myths about kissing or, you know, about public restrooms or whatever, and they're nervous wreck, you know. They're coming in, they're in tears, they're like, I don't want my friends to know I'm here, I don't want my family to know I'm here. We start talking about risk factors, and it's something like, well, I kissed so-and-so behind the soccer field last night, you know, and they're terrified.
Right.
You know, they're like, what am I going to do? I can't take all these medications and play soccer, and, you know, it's just they're so uneducated.
And all you did was kiss him.
And yeah, exactly.
Right.
And, you know, so that's where the education comes in, and that's where our youth action group comes in, I think, for our youth, and I'm just kind of throwing that in there. Because they're educated, and then they go back and educate their peers. But we've had that, you know, just halfway through a test, you know, just somebody have so much relief from just knowing you're okay.
Well, and I talked to someone about that just yesterday,
Yeah.
and it was a grown person. They were like 24, 25 years old. They were looking at their risk factors from the last time they were tested, and they asked about, you know, kissing. If I've kissed someone with HIV, you know, it's like, you know, why is breast milk one of the bodily fluids? Well, look how much the baby's ingesting. That's how much saliva you would have to ingest for that to be a risk. And so, you know, when you look at, you know, because breast milk always comes out there, you know, when you're looking at your bodily fluids, why breast milk? And why not saliva? Well, no one swallows a gallon of saliva, you know, when they're kissing.
It's all in the oral health. Even for a baby, the risk is for oral health. It's not how much breast milk the baby swallows. It's all in the oral health. If the breast milk, if the mother's positive and that breast milk gets in a cut or a sore or into the mucous membranes in the baby's mouth, then that's how the baby's going to get infected. It's if the breast milk makes it all the way to the baby's stomach, that's not going to give the baby HIV. Your stomach digests HIV just like it does anything else.
But it's still the amount.
It's the getting there.
But
well, the
it's the
more there
amount
is, and the
that's
more
going
there's going to
into
be
the
around
mouth.
your
Yes.
around
So
your.
that's kind of like that whole mosquito thing, you know, because they digest it and they can't give it, right?
Right.
Mosquitoes
Right.
can't give
Right.
HIV because it's not HIV anymore when it gets to their stomach. If there's any blood, there might be some blood left on their little thing where they stuck it in me, but HIV doesn't like the air, so it's only going to live a few seconds outside your body. The HIV in that blood, if there's any on the outside of that mosquito, is not going to live long enough for the mosquito to get somewhere else and give it to somebody else.
What about ticks? It's tick season, you know, or is that going to be, you know,
That's
something?
the same thing. So.
Good point.
They
Good
transfer
point. We've had a big problem with that. So I can see where, you know, and the things make sense when you think about them. The myths have some rationale behind them, and people just want to know. They want those answers.
They tell you it's a blood, you know, you can get it through the blood, so mosquitoes eat blood, ticks eat blood, but it's a human, it's HIV, it's a human immunodeficiency virus. So once it goes to an insect, it's not a human thing anymore. So it can't become human again and go back and infect someone else.
So not from kissing, not from saliva. You'd have to have some serious gum issues, bleeding, where it's blood to blood.
Right, for
kissing. For
Right.
kissing.
For kissing, the person that's positive, that's kissing the other person, the person kissing that has HIV would have to have cuts and sores in their mouth, and that blood would have to get into the cuts and sores in the other person's
So
mouth.
not from ticks, not from mosquitoes, not from eating after someone, not from hugging. Not from toilet seats.
Intravenous drug uses. Intravenous drug uses.
Injecting
one way.
drug users, yes. So, you know, needles, any kind of needle that has infected blood is probably one of the highest, is the highest risk.
You said a key thing there that I wanted to point out. A lot of people come in and get a test because they've had unprotected sex with someone, and that's a risk, and you want to get a test from that. But what a lot of people are missing in the prevention message is that person had to have HIV. So we've actually had people come in and say, you know, I had unprotected sex with someone, I've got HIV. Well, not if that person didn't have HIV. You know, they have to have had HIV for them to infect you.
Right.
But we actually get people come in that think, just because I did this, I'm going to get HIV. So you have to keep in mind. So part of your prevention message is, you know, talk to the person that you're having sex with or that you're sharing drug needles with. Talk to that person, find out what's going on. Now, there are other diseases out there you might not want to get either, but
that's
as far
why
as HIV is concerned.
That's why it's so important to protect yourself, no matter how long you've known a person, because you're not with that person 24 hours a day. You know, always use protective sex. You know, use a condom. We even got female condoms. If you need condoms, we give them at Heartland Cares. You know,
and they're free. And
they're free. Yes, just come in and ask for them. You know, protection is right now is the best way is not to have sex to prevent it, catching HIV or any other STDs. But how many of us going to do that? I'm not. You know, being honest, although I am HIV positive, I'm more cautious and protective of the person that I'm with and myself when I do have sex. Right. You know, but even if I didn't, the best thing to prevent it right now is, I say wear a jacket, but put on a condom. Wear a condom, and if the female don't trust her partner or something, we have female condoms. You know, right now it's whether in my lifetime we'll ever get a stop it or not, at least we can start to prevent the spread of it. You know, that's and my goal is to help others, you know, in whatever way I can. You know, I wish somebody I'd have looked at the TV station and said, hey, they got a point, let me call them and see if I'm at risk, you know, or go get a test. I didn't have that option. Drugs, I was so hiked up on drugs and used drugs for so long, I put myself at risk. And is it too late to go back and change that? Yes, but my future can be so much better. Someone else's too, by watching this show and just listening to what where I've been and where I'm at today. You know, and thanks to you all and everybody combined at Heartland Cares working together to help people that don't know. But please come in, get tested. You know, because you can be a carrier and not even know it, that you are a carrier of HIV and not even know it.
That's right.
You know, so please come get tested.
Well, let's just see how easy it is to go and get a test at Heartland Cares, okay? Because in this bag, I have an OraQuick test. And Shane, you do a wonderful job of describing what this OraQuick test is. So I'm going to hand it over to you, and we've got this little container that we need to use to, and I'm going to be your guinea pig today, but we're all going to talk about risk factors, okay? Is that okay with everyone?
Yeah.
Okay, great.
Yeah.
So we've got an OraQuick. It's a free test at Heartland Cares, is that correct?
Yeah, and it's a painless test, which is a huge thing, because it seems like so many people now are coming in and they're like, or if we're at a health fair or something like that, they're like, are you going to have to draw blood? And we're like, no, it's a swab. And they're like, oh, great, I'm going to tell my girlfriends or whatever.
They go start gathering people up.
Yeah,
That's
yeah,
great.
it's amazing. But yeah, all it is, and I'm going to go ahead and hand it to you. It's a swab. And right here on the end of it, there's a cotton pad. And you're going to want to take that pad and you're going to rub your gums, kind of like you're brushing your gums.
Okay.
You're going to do it about 7 times.
Okay.
And then flip it over and do it 7 times on the bottom.
Okay.
All right?
Okay, so here's my test. And I'm going to, like this.
Yep, just like that.
While she's doing that, we can remind everybody that you can't get HIV from saliva. It's an antibody test. It's testing to see if your body has the antibodies that fight HIV, and your body stores antibodies in the cells in your gums. So it's scraping those cells off to put them in this solution to see if it finds any antibodies. But you can't get HIV from saliva.
Right. I have scraped. Now, I've got some lipstick on there. Is that going to matter? Will that have any effect on my test?
You know, it's funny, the old test we did with the swab, anything you had in your mouth, you had to wait an hour before, you know, after you ate to take the test. This test eats right through it.
Oh, okay.
It's actually sensitive. But yeah, what we're going to do is just stick it down in this solution right here, this little tube, and you just leave it in on there. I know a lot of people still remember our old test and they want to break it off for us, but you just stick this one down here, and in about 20 minutes we'll have Krista's result.
Okay, great.
So,
So what are we going to talk about for the next 20 minutes?
well, this is the good part about our test.
One thing about the test is a lot of people panic when they see a line go across that test. Do you want to explain to them about the
Well,
lines?
actually, that's the first thing I do is
Yeah.
we're not looking at this at all. Sometimes you have to get it just out of people's sight because you need to focus on the whole counseling aspect of this, which I think is the great part about this test. You know, like I said, whenever I used to go give blood, you know, if I would have ever got a positive test result back, they would have just called me with it. Can you imagine finding out you're HIV positive from a call on the phone?
No.
So this way, I mean, we get to talk about, you know, why did you want to come in for a test today? Do you feel like something has put you at risk for catching HIV?
Okay, so then when we're talking about risk, we're talking about those same things that you were talking about, Terry, that some different examples of people coming in. They're going to talk about, like you said, I had unprotected sex with someone.
Right.
So
And
that would be one thing.
as a counselor, we're looking for things that have brought you into contact with blood or semen or vaginal fluids or breast milk.
Okay.
And so we're just trying to get you to tell us, but just like Shane said, we're going to start by saying, so, you know, why today? What made you decide today to come and get an HIV test? Most people have already made this, you know, they're sitting in the lobby, and by the time they get to us or wherever we meet them, they're like, okay, I got to go. I got to say this. Because that's part of it, just to get it all out there and say what's going on.
And I think one of the cool things of the way we start out our test is we don't ask for your name.
No.
You know, how many
Oh,
places
yeah.
can you say, never say your name to them, and they're fine when
Or
talking
social
to
security
you.
number.
Yeah.
There's
yeah.
no
You know,
what you see right
anything
here.
that's going to link, you know,
Right.
your personal data
Yeah.
to that conversation.
So it's anonymous.
It's
Yes.
anonymous and it's confidential. We take pride in that.
Or can I have a copy of your insurance card? I need a $15
Yeah, we don't even
copay.
ask
That's
that.
it's free. Wow.
So yeah, we don't ask for an insurance card, so there's no way of identifying. We ask for something that they will know it's their test. You know, like it could be their dog's name or
Birth date.
birth date or something like that.
Yeah, there's
with-
just a little information that we have to collect just to help with statistics.
Well, Shane, why don't you ask Krista what her risk factors are, and then we can identify what we would pull out of that as counselors.
Okay.
You know, like Terry was saying, the things that we look for. That might help.
Okay. Well, so Krista, this is like your third time in this month.
Oh gosh, on public TV.
No. So let's just put you in an example of, well, if you'd like to talk about your own any risk factors.
Well, and like I said, when I took my first test 10 years ago, I had been in an automobile accident. It was at that time period that the blood was iffy, you know, so that was kind of scary for me. It was kind of on the cusp, and I hadn't even thought about it because I'm healthy. You know, and I think that's the thing that always is the most concerning, is that with HIV, you can feel healthy, be healthy, not have any symptoms. So healthy really isn't, and that was one of the things I found out, is that you can have no symptoms and be positive. And so I thought, well, you know, I'm healthy, but that wasn't really any comfort to me, you know. So, but I knew I had to have blood, and I've been married more than once. So that means I've had more than one sexual partner, and I don't know a lot about, you know, I didn't know a lot about the past sexual history of my husband before, because that wasn't something that we talked about. And I'm thinking, you know, gosh, you're supposed to talk about that stuff with someone that you're, you know, in a relationship with, but I never did talk about that. And I do know that that person, you know, had had some drug use in their history, and so that's kind of scaring me.
Yeah.
And I want to make sure I'm okay, because I am very happily married, and I've been in a relationship for a long time, and I feel like we have a partnership, but it's still my responsibility to know.
Sure.
You know, and I know that I've been monogamous ever since I've been with my husband, and even when we were dating. And so I know, you know, how long it's been, but what about before then? I guess that's what I'm concerned about. What about before then? I know I've been monogamous for all of these years, but what about before then? And can that just be in my body?
You know, Krista, you bring up a really good point that a lot of people ask me whenever they come and get an HIV test, and it's that whole, you know, well, I heard that HIV can lie dormant in my system for so long. You said something about, I know it can go without having symptoms in my body. And so many people ask that question, and that's the great thing about the HIV testing today is unless you've had a risk factor with the 4 bodily fluids, blood, semen, vaginal fluid, and breast milk in the past 3 months, we'll know your HIV result from 3 months ago to the time you were born. You know, it doesn't lay dormant in your system. The test picks up on those antibodies that HIV actually will produce if it's in your system.
Okay. And go ahead.
I would say that's another good reason to get a test is, you know, it's there. HIV doesn't, you know, grow. It's there. The antibodies are there. So if you go get the test, you know it's there. So that it doesn't lie dormant. And Isaac used the word carrier earlier. You go get a test. You find out if HIV is in your body, and then you don't wait 8 or 9 years till you get sick, and then go get a test. You just go get it now, and then you know.
Because in my case, I possibly had the HIV virus 6 years previous to finding out. Never got sick, never had symptoms. My immune system was so strong. And when I went in the hospital for spinal meningitis, once my immune system weakened from that, the virus appeared, and it took over. And but you can be a carrier and not have any symptoms for years. That's why it's a good thing to go and get tested, you know, because you might not know.
And so, you know, based on the scenario I gave you, and let's say that I'm negative, and I told you I'm monogamous, and I have been monogamous, and I believe my husband is monogamous. And so what kind of advice, you know, do I need to, you know, I don't use protection. Do I need to be concerned about that?
Well, something that I always strongly suggest, and to really drill it into people's heads, because I feel like we all push off our care onto so many different people that we're ultimately responsible for ourselves. You know, I learned in phlebotomy to use universal precautions, treat every person you run into with the most deadliest disease that you could run into. So you may believe your husband's monogamous. You say you're monogamous. Well, that's great. I'm glad. But, you know, always use universal precautions. But if you don't want to use condoms, why not get your husband to come in and be tested? That's a really good thing to do. You know, get tested together. You know, come by. We'll take one in one room. I'll let Molly do Paul. You know, it'd be great. And
so what other questions were you going to ask me?
Ultimately, we're going to leave it up to you, because in the testing situation, it's very what we call client-centered, which means we're going to listen to you.
Kind of like when I go to the doctor.
Right. We're going to listen to you. You're going to tell us what your risks are, and we're going to ask you what you want to do about that. And we're going to make suggestions. You know, you're in a monogamous relationship, so you trust your husband trusts you, so you can just go on doing what you're doing. You could come in and get a test. You could get him to come in and get a test. You could decide to use condoms. There's lots of different things you could do, and we're going to talk to you about what those possibilities are, but then we're going to say, what do you feel like you want to do?
Okay, so it's my choice.
And
go ahead.
Sorry, Isaac. No, go ahead.
I think another thing that I just got done working a women's health fair in Hopkinsville, and we did around 89 or 90 tests, all female. And a lot of the women that were in a monogamous, or felt like they were, you know, they said, I don't want to offend my husband by asking one to get a test or two to wear a condom. So I think that's a fear for women. You know, are they going to go back and say, well, are you doing something that I need to know about? So I think that, like Terry said, we're going to offer any option in the world, and if they take none, at least they got tested and they know their status.
And if you say, you know, I don't want to offend my husband, then we're going to help you figure out how to do that. We'll practice, we'll role play, I'll be your husband.
As counselors during the test. So that's what we would offer you, you know, what you're talking about. You know, I mean, I'm not, you know, I'm just saying that, you know, that tends to be one of our one of the largest issues with testing married women. They don't want to offend, or, you know, maybe 10 years ago they might have done something or talked to somebody they weren't supposed to, and then it comes all back out, you know, and they don't want to go through that again. So we have to be, you know, we're definitely open to anything that's going to suit the person that's being tested.
And speaking of being tested, how is that one going now?
Well, actually, because we believe very strictly in confidentiality. I want to protect your confidentiality, Krista. so I'm going to give you this result after the show's over.
Okay, I appreciate that.
Yeah, no problem.
I appreciate that.
No.
And so, you know, for our audience, we need to say, what is the highest risk of getting HIV? What is our highest risk? We've talked about the 4 bodily fluids, but what's the highest risk as far as sexual risk?
As far as behavior, the highest sexual risk is unprotected anal intercourse.
Okay.
Unprotected anal intercourse, unprotected vaginal intercourse are both the riskiest sexual behaviors that you can participate in.
And it's because of that vaginal fluids and
right,
semen.
because you're coming into
And then
contact, those
sometimes
fluids are coming into
blood.
contact with blood, mucous membranes, easy access into the body.
Okay.
The highest risk for getting HIV is a blood-to-blood contact, which is usually through, as Isaac said, sharing drug needles. So those 3 things are the 3 riskiest behaviors that can bring people into contact with HIV.
Okay.
But they're kind of numbered off that way, but they're all just, you know, right there together. One's not that much more risky than the other.
And so oral sex.
Oral sex is risky, but it's much less risky. If you were using a risk reduction approach, like we could say you might want to have oral sex instead of having unprotected vaginal sex, that's going to reduce your risk a whole lot.
Or even
That's
oral
gonna cut
sex
it
with
more than in half.
protection.
Yeah.
Oral sex with protection is going to be greatly a lot safer.
And someone that uses drugs is also a big risk, I think, because that's how I contracted it through females. And because once I started drinking or using whatever drug it was, I was over in that fantasy world. And protecting myself was the last thing I thought about. It was, hey, getting to it, you know what I mean? And it can be very costly in the long run, you know.
And on the lines of the drug use, Shane, we offer free some type of small kit at the clinic.
Yeah, actually, we sure do. It's we call them just, you know, prevention kits, but in Kentucky we don't have a needle exchange for people that share needles. Some other states are fortunate enough to have those kind of
And I think
programs.
the federal government back in July just changed the laws regarding needle exchange, and they're actually now more in favor of promoting needle exchange. Hasn't made it that way to Kentucky yet, but I'm sorry, I didn't mean to interrupt you.
Oh no, because I mean, you know, the best way not to catch HIV but is not share needles. You know, but unfortunately people can't get needles all the time, so we hand out these little kits, and they've got all of the stuff that you would need. It's got a little cooker for the drugs. It's got some bleach solution that you would just suck up and shake her you pull it up, shake it for about 3 minutes, squirt it out, pull it up, shake it for 3 minutes, squirt it out, and then you've got sterile water, you've got alcohol pads in it. Another thing that people don't think about a lot is crack pipes. You know, they can be made out of glass, or they can be made out of metal, or even I've seen, you know, people have one-hitters, you know, for marijuana, and it's just this little, you know, wood box that has a little metal pipe in it, and if I'm taking a hit off of that and it burns my lips and I've got all this blood right here, and I hand it to you and go, you want to take a hit? You know, you're going to get that blood in yours.
Sure.
And not saying that any of this is all right to do, because most of it's against the law.
Right.
And we know that.
Sure.
But
we want people to be safe.
what we're doing is identifying some of the risks, letting the public know what risks they're at by doing these things. I wish I'd have known back in my days. Maybe I wouldn't be in the shape that, well, maybe I wouldn't have HIV. The shape that I'm in is great because I listen to my doctor and I do what I'm told. But maybe a lot of people won't have to be in that risk category, you know. And like Molly said, we have classes on, I'll let you further go into that. The classes on
peer advocacy.
The peer advocacy or the HIV or HCI university classes, is that what you're on? Well, we just, you know, do different classes. It all just depends. We don't really, prevention does educational type things for anybody who comes in. You know, if someone come into it for a test and they said, you know, I'm a drug user, I'm having a hard time getting off, can somebody show me how to at least keep my stuff clean? They're going to explain that, you know, because that is the goal for what we're trying to do. You know, we know it's illegal. We don't want people using, however, they are using. So, you know, at least you're going to have a team approach of people that are going to be able to, you know, to say, okay, let's reduce the harm somewhat and show them how to properly clean a needle.
Well, and through these classes, one of the things that happens is you develop a bond, and you develop a trust. And so that person, if they do want to get off the drugs, are going to be more likely to turn to people who they trust. And we've got all those resources. You know, we're not promoting anything. We're trying to stop the spread of a disease.
That's actually what changed the vote back in July for the federal government. There's a lot of research out that shows that if you do provide a needle exchange program, if you do provide cleaning kits, that brings people into care, and it helps people to get access to the people they need to reduce their drug use, or maybe eventually get off of their drug use. So it turned out to be a good thing, even though one of the big things that people don't like about a needle exchange program is they feel like they're promoting drug use. And you know, now we've had all these years of research that show actually the opposite is true. You're actually getting people into care, and they may start by sharing in your needle exchange program, but they're eventually going to go on into a program to get off of drugs.
Absolutely.
And I also wanted to say that all the kits and everything that we provide, and all that's all provided us by the Center for Disease Control in Atlanta, so it's all approved stuff. It's all exactly what we're supposed to provide for these services.
And I think that all falls under the Heartland Cares, the one-stop shop motto, and I think that's what we're trying to get across here, is we have the education, we have the people there to teach anyone in our community and the surrounding communities what they need to know, and we have the resources to give people, and it's all free.
Excellent.
You know, so what better?
Absolutely. And so to our audience, we'd like for you to take the challenge. You know, if we've talked about something today that you might be concerned about and you want to test, then you've got some different options. We've talked about how to talk with your doctor about those options, and we've also talked about how one of your options is you can come to Heartland Cares, and I hope that we've shown that we're good people and it's highly confidential and you can trust us, and we're going to educate you in how to make yourself and your family as safe as possible, and I hope you'll tell others as well. And there are some other things that we're doing here. With testing is very important, prevention is very important, and we're trying to get the word out in so many different ways. And Channel 2, we thank Channel 2 so much, because I can't go anywhere anymore without somebody stopping and saying, "I saw you on Channel 2," and that is, or Channel 6 or whatever. So the media, there's so many people out there to reach, and we've discovered that this is just the most wonderful way in the world to get this information out, because you can watch it in the privacy of your own home. Nobody knows even what you're watching or why you'd even want to watch that, and you can get the education and information that you're going to have. And so we've done some things to kind of follow up on that, and I want to talk about that a little bit so the audience can know what to expect in the future.
I think one of the coolest things that we can offer now is if, say, I live here in Paducah, but my family lives in Murray, you can just call the clinic, at our 1-800 number, 1-877-444-8183, and just ask for the media section, and they can mail you out DVDs of these appearances, some of the things that we're doing, like SISTA.
What is SISTA? Tell us about SISTA a little bit, because that's getting ready we're going to start programming that in the next couple of weeks.
I can't be a SISTA, but I sure could be a fan of a SISTA. I think it's such an awesome program, because it's like girls' night out on steroids. It's just so much fun. It's teaching people, especially women, minorities, but just anybody, women, especially rural women. I mean, they have some of the same stigmas as minority women, but it just teaches them to be proud of being a woman.
Wow.
To make their own choices, to find their support system. Like, I know right around me, I have y'all as my support system, but a lot of people aren't as fortunate to know, like I do, who's supporting them, who's got their back. If I had to go home and tell somebody that I was HIV positive, I talked to Molly first before I did, because she's my support. And this program, it helps these women identify who's my support. And the logo of the whole thing is, Sister Love's strong, Sister Love is safe, and Sister Love is surviving. And I know Daquita, I've tagged along with her many times. I've seen her after she teaches this. The women are just laughing and having so much fun. I'm just proud to be a part of you know, helping us out.
And so she's going to teach Sista on Channel 2.
Yeah.
And so we're going to
yeah.
have actual classes on Channel 2 for the audience to watch at home so that the audience can be a part of Sista. So how are they going to be a part of Sista? Are they actually going to get a certificate to be a part of Sista if they want?
There's all kinds of stuff we're giving out for participating in this. You get certified. There is 5 episodes that are going to be airing. So we're going to ask everybody to go, if they watch it, to watch the 5 episodes, just so they get the full Sista experience. And Sista. And recently we've been working on a website to try to get this all, you know, very simplified. You just go to the website. It's www.hiv.hcares.org. And on there you just click the media tab and you see Sista in big bold letters. And it takes you right to where you need to fill out the forms for this. And you basically fill out the forms during the episodes. All you have to do is hit submit. It sends it right to us. You don't even have to email it to us.
Wow.
And once we get them all collected, we give out little incentives, and incentives can be some really good lube and some really good condoms. If we have a little extra, we might be able to give more.
Or maybe the first 50 people who fill out their forms might get a movie ticket or something like that.
I don't know, can we, Krista?
I think we probably could do something
So
like that.
if they miss it on Channel 2, on the actual Channel 2, they can also go to Paducah2.org, is that correct?
Yeah.
Excellent, excellent. So there's different ways. They can go on our website, which we give them, Paducah2.org. They can call us if they don't have access to computers, and we can mail it out for them so that they can then turn it back in. But the important thing is being able to sit at home and be a part of Girls' Night Out and learn about how to talk to your man about HIV or about being safe or protection, or, you know, just kind of girl talk stuff, but the real nitty-gritty girl talk stuff that everyone needs to talk about. And if this is a success, then we may have a boys' night out or, you know, kids' night out.
Well, there's Sista is an intervention developed and funded through the Center for Disease Control also. So they have there's Sista, and there's Healthy Relationships. It's aimed at people who have HIV, and then there's one called Safety Counts that's aimed at injecting drug users, I think.
Yeah,
and
or multi-drug users.
Yeah, poly-drug users.
Okay, and then there's Many Men, Many Voices, just aimed at the men who have sex with men community. So there's lots of different ones out there, and I think we're hoping to maybe introduce Paducah to all of them.
And for and to let the public know, we have all genders, I guess the way to say it, all types of genders, you know, gay, straight, female, you know, whatever. We have it in-house. You know, you can call and talk to either one, or you can come in and have a one-on-one conversation. You know, I think that's very important, because we don't label anyone. Everyone's a human being. That's the way we look at it, you know. Please come in, and you come in, you will talk to someone. You will not leave disappointed.
Right.
So there's lots of things that we're going to be doing, and there's things that we're doing presently that I think are really important for our audience to know. We've got a youth action group that we're doing a lot of work with. It's been going on for how many years, Molly? It's been like 4 years?
I think this is the 4th year.
They do a great job.
They do an excellent job. We just started for this year, and we had our first meeting last Thursday night. We've decided to have regular meetings on Monday nights at 5 at Heartland Cares. So
we'll have that on our website as well.
We'll have that information on our website. Anyone who's between the ages of 12 and 24. 12 and 24. I tend to go a little younger because I'm older.
But, that's so cool, inviting college kids in too.
Yeah, and we're excited about that. So anybody between those ages who'd like to come in and see what YAG's all about, if you just want to attend a meeting or, you know, talk to a peer that's maybe already involved or has been involved, we would you know, it definitely set somebody up.
Oh,
But
come
it's
in-
peers helping peers. And,
Oh, come
and it's
in.
that youth group because youth is our highest growing population.
Right.
Correct.
And it's that same age group that I just gave that's our fastest growing
Right.
population.
And if you have a-
especially our minority population.
And if you have some free time, come in and be a volunteer. We
There
got
you go.
volunteers working today that end up knowing as much as we do because they work around it. They're getting educated on a daily basis, and it's on their time. You know, and that's great. Come in and be a volunteer. Be a part of it. You know, it's going to take us all in order to hold this at bay. You know, it's just not the one that's positive, not just only us that's in the agency. It's going to have to be volunteers and the public, all of us working together to get this done.
Well, how many volunteers do we have last year, Molly?
We had 179 volunteers last year, so it's definitely a community
179
investment.
volunteers.
You know, we have to, you know, we need the community as much as the community needs us.
Absolutely.
You know, so I think that's important.
And we're also part of United Way, which is really important. And I think
Great.
what you said about community, you know, that is, if I had to say one thing, I would think that's what we are about. We're about caring about our community. And we're caring in a way of some things that a lot of people don't even want to talk about. But we are helping our community, protect our community, make a difference in our community, create positive change. And we're starting with the youngest we can possibly start at, which is 12 years old for us. Parenting's a little bit different. We need to start younger as parents, but all the way, you know, up to our elderly, which is also another population that's growing because they're more active, they're healthier, they live longer, and sex is not the same as it was, you know, 50 years ago. You know, the diseases are not the same as they were 50 years ago, and so educating the elderly as well is important.
Yeah, I tested a lady at the last health fair we were at. She was 71. 71 and still extremely sexually active. A widow. You know, just fell into those risk factors just like someone that was 19, 24, or 40, you know. So it's extremely important. And she took her little bag of condoms and was glad to have you know, the experience and, you know, the education that we offered, and went on her way. So that, I mean, that made me feel good, though, that she knew that we were providing these services. You know, that's a question we ask when we go to health fairs are, you know, when do you get tested last, and, you know, how often, you know, and where, and those sort of things, so we can know and make sure we're not, you know, kind of crossing over. But and she said that she gets tested by Shane, that good-looking guy, every year at this health fair. Where is he? And I said, well, you got me, okay?
I think that's wonderful. And with the community, there's something else we have to offer. And everything that we're talking about today, you've heard us talk about health fairs, you've heard us talk about testing. You can come to us or we can come to you. If you have an event that you'd like for us to come and work, we can set up a booth, we can educate and teach. We work with churches, we work with businesses, we work with the community at large. And remember to please take the challenge. And if you just tell one other person, if you see this show, just tell one other person what you learned on this show. And we really thank you. Thank you all.
Thank you.
Very much.